Lung cancer kills more Americans than any other cancer. Another alarming fact is that doctors are seeing more cases of lung cancer among people who do not even smoke. This health issue is affecting numerous demographics. One group greatly affected is non-smoking Asian American women. This morning, we're joined by Surgeon Dr. Jeff Velotta and fellow physician and his patient, Dr. Susan Brim. Thank you both so much for joining us. Doctor, first of all, why are we seeing non-smokers, first of all, getting lung cancer? I mean, that seems kind of something that we don't hear a lot about because we know smoking is linked to lung cancer.
Yeah, Andre, that's the issue, is that we are seeing a rising number of non-smoking Asian females, and that's the first. Our studies recently is coming out soon in chest, and the idea is that we don't know all the causes. We do think there are some what's called biomarker or genetic alterations of the actual nodule itself or the cancer itself that are causing this, but there's so many other factors that we don't know, whether it's pollution or radon or family history or lung inflammatory disorders. We don't know that, and that's what we're currently studying.
But that's pretty scary. I mean, you know, as someone that's treating patients, and we'll get to Susan in a minute who dealt with something like this, but that's scary not knowing at all. What does that mean for non-smoking Asian women?
It means that the one thing that I want to come across is that if you have, a chronic cough or some pain in the chest that doesn't go away, it's been a few weeks to a month, often people get thrown to the side and not worked up. That you need to, it's not going to just be one little thing. It's going to be a thing that keeps going. You need to tell your doctor, about it and to get evaluated with some type of imaging. The key is that you want to be proactive in your care and not just think, oh, I don't smoke or whatnot, that it's never going to happen to me.
That's probably something that you see a lot of people just dismiss it from their mind because they do not smoke. So yes. Dr. Susan Brim, you're a doctor also, but you also are someone that dealt with something like this. Tell us your story.
Sure. So kind of like Jeff was talking about, my experience started out when I started having some really mild chest pain. And it wasn't severe. It was just annoying, kind of dull pain. And I watched it, and it was ongoing for about a month. And it just was there all the time, and I thought something is not right.
Like lung pain, like pain in your lungs?
It was kind of up in the top here. Sometimes I would think like, oh, is this my shoulder? But it was just constant. I would kind of be laying in bed at night and it'd be like, that's still there. So I went and saw my doctor. We did an initial set of tests, which actually looked okay. And so we talked about it and said, okay, let's keep an eye on it. So I gave it another month or so, and I was actually, I think, complaining about it to my colleague on shift one day, and they said, go get that checked again. And I ended up getting a CT scan, and we found a large mass on my lung. And just like Jeff is saying, my own bias too, along with my doctors, we initially said, there's no way this is lung cancer. You're too young, you don't smoke. So we started looking for an infection or something else as the cause. And when that all came back negative, I ended up going over with Jeff's team and getting a biopsy and confirming the diagnosis of cancer.
How are you doing now?
So I'm cured right now. So thanks to Jeff and his team, I luckily was caught very early stage, and Jeff did a surgery, took out half of my lung on the left, and
Is it scary not knowing why you would develop lung cancer as someone that's a non-smoker?
It is. I think I feel immensely lucky that I had a symptom, that I had doctors who kind of listened to it, explored it, and then got referred to a team like Jeff's. But it's certainly scary, but it's also, I've been so interested to learn about all the work that Jeff's doing that's showing that people like me are having rising rates of this.
Dr. Velotta, let's talk a little bit about your recommendations. You talked a little bit about when people feel certain things, do not ignore it. But what are your recommendations about prevention or about catching it early, at the very least?
Yeah, that's the tough part, Andre. And I know we spoke about it a few weeks ago on lung cancer screening. This population, non-smokers, Asian females, do not qualify for what we spoke about, what's nationally recommended for lung cancer screening. So it's different. So right now,
you cannot do it on your own?
Right. It's not. You can't get it. It's not. You cannot get it through a screening CT scan.
Wow.
It has to be. So that's the hard part. We're not there yet. This is still a new finding. This is a new finding, and it's not we're still working on the smoking cases. And we're still doing, we need to do a better job on that. But so this is more about the patients knowing, the family members knowing, especially in this population in the greater Bay Area where there's so many Asian Americans out there. In fact, 20% of my, population that I see for lung cancer don't smoke or have anything related to that.
20%, wow.
20% of all the lung cancer cases, and the majority of the cases that we're seeing, more than 70% are of all lung cancer here, at least in the Bay Area. I mean, it could be different. It's different everywhere, but in the Bay Area are women.
Wow.
So that's something that I think women aren't used to hearing about, whether you don't smoke or whether you're Asian or white or Latin. That women are getting lung cancer more common than men, at least in our area right now.
Susan, interesting for someone who went through this. What is your recommendation to folks that are watching this today?
Yeah, similar to Jeff, and as a physician myself, I think you don't need to be scared at every twinge, that think the worst thing could happen. But if you have a symptom that's really persisting, that's really not going away, make sure you talk with your doctor about it. And even if you have some initial testing, when they say keep an eye on it, and if it's not going away, follow up with us. I mean, we really do mean it, and so I think that's the advice that I would give.
And Jeff, are you making any headway in terms of doing the outreach to the female Asian women here in the Bay Area to get them aware of this? What can be done to get them more aware that, hey, you may want to check on this?
Yeah, two things actually. That's absolutely important, especially in this area. So working right now with the Asian Health Services down here in downtown Oakland, Chinatown, and also working alongside UCSF. Called the FAN study, which is essentially called the Female Asian Never Smoker study. And we're reaching out to people that either have had lung cancer, that are Asian and female, that don't smoke, or have a family history of it. And we're reaching out to with surveys to tell us about, where did you live? What part of Asia did you come from? So we're actually learning that currently.
All right. Well, I'm hoping that folks that are watching this today are understanding the seriousness of the situation and at least gives them a clue to go in that direction and get it checked out at the very least and check with their doctors. Jeff, Susan, thank you so much for joining us today. We really appreciate it.